report that came out, NewJersey.com, I heard about it through NewJersey.com as a study that was done by Harvard, and saying that, while it's a very difficult situation, with children being so far behind academically due to the pandemic, some districts have done better than others at catching up to where they were before the pandemic. So we're only being compared to other similar districts, and only to get back where we were before the pandemic, which was, as you know, the low grade level, quite a bit to start with. So I'm going to quote part of a paragraph. Newark's recovery, on the other hand, ranks among the worst in the state, along with that of Patterson and New Brunswick. New Brunswick saw even bigger losses. We talked about Newark and Patterson. More than a full grade level's worth of reading, and in math, all three of the districts lost roughly 1 1/4 years of learning. So we did, and I saw a chart comparing districts with a similar socioeconomic, judged by the number of free lunches. And we were actually at the lower end of that, because it goes 75% and up, but we were the most learning loss, which surprised me, honestly. Because I know we got a lot of tablets out. I also know there were some connectivity issues. But I know we got a lot of food out, and I congratulate the district on that. I know that for a fact. And you don't learn anything if you're hungry, so that was good. But this is very concerning now. And I saw that the grant that we got for the intensive tutoring was not the full amount. I don't know if that's because we're not a bigger district, but I really want to know what we're going to do differently going forward. Because what we did this year did not work particularly well. I'm going to hope it was better for children, like emotionally and socially, than what has turned up on the academics so far, but still. Thank you.
Thank you. We have next.
I also had some similar concerns as were raised by the previous speaker. And I know she had just asked a question of what the district will be doing moving forward. I'd like to re-ask that question and see if we have an answer to that.
Good evening, everyone. We have began, in addition to implementing our WIN period, which we started last year, it's an additional 36 instructional minutes as students are engaging in, that we're providing multi-tiered levels of support for students. So we've used multiple measures of data to identify students based on their needs to be able to provide them those services. In addition to that, this year now, we've improved the WIN period, but we've also implemented an academic support plan. And we've been phasing it in by 3 different phases, where we have revamped our extended school day program, where it's focused on math and language arts, specifically the different types of items that are assessed in the New Jersey Student Learning Assessment, but also focusing on major content standards. Our phase 2 focused on how we were using the high impact tutoring grant. We have focused on grades 3, 4, and 5 mathematics, because that's where our major scores were the lowest in math. And then our phase 3 is how we've been incorporating a lot of these strategies throughout the school day. So now we have at least once a week that we're focusing on math and ELA, the major content standards that are assessed in the New Jersey Student Learning Standards, but in addition, taking into consideration how these interventions are working. So this year, with our WIN period, we have implemented 2 different cycles. We just completed the first cycle, and we just started our second cycle. So these are things we're doing this year that are improving some of the things we put in place last year, but also adding some interventions.
Great, thank you for that thorough answer. And I also, related to that, I'm curious, for the resources that are being deployed to address the learning loss issues, what the breakdown is, or what the focus is of the different age groups? Are you focusing those mostly on programs in the elementary schools, or is there a focus also on the higher grade levels as well?
Our intervention services team, our
Yes.
multi-tiered levels of support, we're actually providing that K to 12.
Okay, thank you.
And we're using research-based curriculum to be able to implement those interventions.
I appreciate that.
Thank you.